Everything you ever wanted to know about separation-related problems right here. First of all, separation-related problems are called also separation-related disorders. You might see on your pet's diagnosis list separation fear, phobia, anxiety, isolation fear, phobia, anxiety. There's all these different terms. All you need to know is it falls under the umbrella of separation-related problems, SRPs, separation-related disorders, SRDs, and they occur on a spectrum. No two dogs are alike, but it's okay because treatment is very similar regardless of the dog. We really go in four prongs. Number one, your dog has to be well, and I'll talk to you about that in a minute. Number two, medication, supplements, and foods. Number three, behavior modification. Number four, environmental modifications. All right, number one, wellness, easy peasy. You're going to ask your doctor for a CBC, a chemistry, a free T4, a fecal DX plus Giardia antigen, and a urinalysis. That's the minimum database. Your dog also needs a really good physical exam. Now, a lot of dogs that have separation-related problems also have worry, concern, fear, stress, anxiety, aggression at the vet's office, okay? Now, if that is the case with your pet, you're thinking, my dog cannot be examined. That could be the case, and also the veterinarian can observe your dog. They can observe for lameness, uneven nail wear, asymmetrical, that means different on either side, musculature. They can use pre-visit medication so that they can draw blood from your dog to get that minimum baseline. You can catch a first morning urine to get urine. Okay, number two, medication, supplements, and foods. There are foods such as the Royal Canin Calm diet that have aflatoxazepine in them. That diet also has L-tryptophan in it. These are calming agents for dogs in that food. But that particular food has been shown to reduce stress in dogs. It's certainly worth trying if your dog is under 40 pounds. If your dog's over 40 pounds, unfortunately, they'd have to eat so much of that food that it probably wouldn't be healthy and they might gain some weight, and we don't want that. Look, there's some great supplements out there. There's Zealkine, Angstitane, Soliquin, Composure Pro. Those are the only four that I recommend because I like to recommend supplements that have research that shows they work and have a technical service veterinarian that I can call if I have any problems. Which one's right for your dog really depends on your dog's clinical signs, and that's something you've got to talk to your veterinarian about. Most of those supplements are going to take 4 to 6 weeks to work, but actually all of them have some evidence that they may work within hours to days. So maybe worth trying for your pet. Now, if your pet has food allergies, there's only two of those supplements that they could take, and that would be Soliquin, which has hydrolyzed protein, and Zealkine, which is unflavored. Angstitane and Composure Pro are both flavored. So let's steer away from those if your pet has food allergies to the flavoring in those tablets. Let's talk about antidepressants. Okay, we have two that are FDA approved for use in dogs with separation-related problems. That's Reconcile and Clomicalm. You want to ask for the brand name because we know that these products are more potent, that they are higher quality, and that there's quality control. We know exactly how many milligrams are in every single one of those tablets, okay? So ask for that brand name whenever possible. Because they take 4 to 6 weeks to work, and this also includes those supplements I just talked about, we will often choose a short-term medicine. Maybe we'll choose Xanax or Valium or Ativan or gabapentin or pregabalin, right? So there's lots and lots of choices. And again, what your veterinarian chooses is going to depend on your individual pet's needs. Generally, you're going to start that short-term medicine that's just going to be used for departures. And then after the workup is done, your veterinarian is going to start your pet on that long-term medicine, supplement, diet change, et cetera, et cetera. And then eventually we hope to get your pet off of that short-term med. Reality is, by the time pets come to see me, it's really unlikely we're going to get off that short-term med just because the behavior is severe. So lesson learned, get your pet to your veterinarian immediately when there's a problem. Please do not wait to seek help. Then there's environmental changes. Environmental changes include leaving your dog with a food toy, which you absolutely should do. There's scientific evidence to show that they work for separation anxiety and keep your dog calm even after the food toy is empty. We want to make sure your dog has those toys well before you depart, okay? And they last well into your departure. Now, what about behavior modification that doesn't include food toys? Well, You can do desensitization and counter conditioning. That's where you slowly expose your dog to your departures. There's lots of ways to do that. There's one way that uses food, one way that does not. But to me, at least in my recent experience, one of the most effective ways is to use a device like the Go Doggo or a Furbo or any remote controlled treat dispensing device, reinforcing your dog for calm behavior while you're gone. Here's what you need to know about behavior modification. Do not attempt this by yourself. Just don't do that. Okay. So often people get to me having attempted this by themselves and their dog is a hot mess. Instead, get with a qualified positive reinforcement trainer and get the process going. Then you can wean yourself off of the trainer when you know what to do. But please do not start that type of technique work by yourself. Now, within desensitization and counter conditioning, there's different types, and you can go to my Instagram post on this where you'll get more information on that. There's other environmental changes that you should be aware of. Yes, you should make your departures low key, but do not ignore your dog. If you want to hug your dog and say goodbye to your dog and sing a little song, then do it. Those old ways of thinking where we told you to ignore your dog and to make your departure very low key, like different than it usually is, we now know that that actually makes dogs worse. Oh my gosh, and we recommended it for so long. Just be yourself. Just be consistent. Use positive reinforcement. Don't yell at your dog and act like a fool when you get home and you find that your dog's peed in your house because he's panicking. And if you panic, then everyone's panicking, and that's not helping anyone. So keep a smile on your face, clean up the poop, and ask your veterinarian for help. Here's the thing. Separation-related problems are treatable, maybe not curable, but absolutely treatable. You can get to the point in almost every case where you can leave your house and have a normal life. So if you are seeing your dog following you around, acting anxious when you're gone, get with your veterinarian now.